Hey y'all. Hey. Hey.
How are you?
Good. How are you?
Fantastic now. Shall we wait a little bit before we start?
Um. Well, we have 1,700 people on here, so.
Oh, so why don't you do the why don't you give your followers a little background on what we're going to be doing here today?
So right now we're gonna do a feet consult. Um, Basically, he is a doctor who specializes in um slimming your feet. Also, if you have any bunions, corns, or anything of that nature, he is your go-to guy.
And I'll take the liberty to introduce myself a little bit. So for all of the followers that are with us here today, my name is Dr. Abraham Wagner from Jaws Podiatry. I'm a cosmetic foot surgeon. Some of you guys may know me from social media. And our goal is to simply have people, make people feel better about themselves. You and I both know, Monique, that a lot of people are talking about, you know, feet, right? Lately, a lot of feet are going around social media. Um, and if I'm not mistaken, you wanted to have a little consultation. Um, are you going to go ahead and show your feet here today to the world, or?
Sure. Hold on one second. If I can figure out how to flip this thing.
Okay, so Monique, talk to us, right? Let's
So
put
yeah, so my feet they're a little wide, um, and they're a little bit bigger than my liking. So I do want them to be a little bit more slimmer.
Okay, let's put both feet together on the ground, on the floor there, Monique.
Mm-hmm.
Right, so I'll take the liberty to just kind of give people recommendations and so on and so forth. One of the things that we see here a lot is foot slimming, right? Some people are just simply not happy with, the appearance of not only their feet, but also the width, right? So a lot of people, when they come and they reach out to us, hey, Dr. Wagner, I'm not happy with the width, right? I can't, I can't find comfortable shoes. I can't find uh, what I'm looking for. And a lot of people, they talk about the side, right? The side of their feet. Do you have a hard time also finding, shoes that fit comfortably?
No, my issue is like with heels. Like I can't really walk in them for a long period of time. But for the most part, like I don't have issues like finding shoes that fit my feet.
Okay, so that's good. Again, foot slimming is something really, really common, whether it's foot slimming, slenderizing people's feet. People are looking for a very hourglass appearance, but I
Mm,
think that you could easily be a very good candidate for that, right? I'm a firm believer that if it ain't broke, um, don't fix it, right?
mhm.
But sometimes that doesn't really apply to what we do. You said it yourself before. A lot of people come here because either they have long toes, short toes, congenital, right, from birth, congenital deformities, ugly corns. Those are the type of things that we do here, right? This doctor must be. That's so funny. I, I love people, right? Anyways, what else, Monique? Tell us anything else that you might be seeking.
As far as like my
Yeah.
feet, I just basically like feet slimming. I don't have any like bunions or corns or anything like that. So just basically slimming it down a little bit.
Okay. I mean, give me 1 second here. So, do, do we want to take some questions that some of your maybe followers may or may not have?
Yeah, do you guys have any questions for the doctor?
Come on, guys. Be nice, guys. Come on. Be nice. So a lot of people, and let me just add to the conversation a little bit, Monique. Believe it or not, a lot of people, you know, they're very, very, you know, not only self-conscious, but embarrassed to show their feet to the world. I think that one of our goals is to let people know that long-term solutions exist. There's the good old saying, no need to hide your feet, right? I'm a firm believer that if there is something that you're not happy with, why not, right? Um,
So here's a question. They said, how long does it take? How long will it take to heal?
well, and that's a great question. So our goal is to continue to use minimally invasive techniques approach to accomplish these clinical outcomes. This is one of those procedures, whether it's the side tuck, right? The side tuck to slim, or even, believe it or not, the good old toe tuck. It's kind of like a tummy tuck for the toe. I know it's kind of funny, but it's one of those procedures where it's more of a traditional approach, right? We don't do lipoaspiration, liposuction. We don't do any of that. Our goal is simply to, right, if we look at the side here, all of this, we want to nip and tuck that area to provide that slimming effect. Uh, we perform all of our procedures here in our office-based surgical suite under local anesthesia. You are awake. You walk in, walk out. And yes, people do walk out using the ugly shoes that we provide. I would say in respect to the recovery of the foot slimming, about 4 to 6 weeks. At 2 weeks, the stitches will be removed. And then we continue what I like to call the scar management efforts from week 2 to week 4. Let's see here. Let's take some other questions, Monique.
So they just want to know. I see some people asking like the cost for the procedure.
For anything pertaining to any cost, just reach out to one of our concierge team members, and they'd be more than happy to assist help. Maybe you can, if you're planning to upload this to your platform, you can put our page info there and so on and so forth. Okay, guys, so I'm gonna take the liberty to answer some of these questions. Is that okay, Monique?
Yeah, that's fine.
What about if you're heavy set? Will it cause pain or complications? So the truth of the matter is that we do find people from all walks of life from all over the world that come here seeking these solutions. It doesn't really matter if you're heavy set or not. We look at not only structure, right? Some people just have big bones, so to speak, right? And in addition to that, automatically people will think, right, that by losing weight, that you will also lose a lot of the weight in the foot. And that's not necessarily the case, right? People are very easy to say, very quick to say, hey, Monique, lose the weight. And the weight will leave the feet. It doesn't really work like that. I've seen both scenarios. I've seen a lot of skinny people, right, that have very, very chubby toes. It's what we call toebesity. And then we have people that, on the other side of the spectrum, heavy set people that have very, very skinny toes. So we've seen all of the, both are scenarios, right? Let me see here. Will her feet get white again? No, they won't get. These are great questions. They won't get white again. If you follow all the procedures, protocols, recommendations, they will not, right? She will be able to walk after the procedure. Absolutely. We will always take care of Monique. Don't worry. No, it's not conscious sedation. This is performed local anesthesia. Monique is awake. Monique will walk in, walk out. Monique, your followers are quite the crowd. Okay, so
Yeah.
for the people that are just joining us, basically Monique is interested in possible foot slimming. Yes, we can make feet thinner and slimmer. Right? Not only is it a functional issue, some people can't find comfortable shoes, but it's also an aesthetic issue. Some people just don't like the way that their feet look. Is this just for white feet? That this is an interesting yes, that's a great comment question, right? We want to make sure that there's no element of obviously swelling, right? Any issues with your veins or your arterial system. But I agree. You're beautiful, Monique, just the way that you are. Absolutely.
Thank you. And then someone asked, does it correct arch issues?
And we also know this is strictly something related to soft tissue. This is not, yes, we do correct, flat feet and flat, feet deformities using minimally invasive tech area. No, we're not correcting flat feet here. Let's see here. Weight loss surgery. You're familiar with that? Yes, we're familiar. Do you take it in? Long toes, doctor. Absolutely. Even the long toes. Monique doesn't have long toes, right, Monique?
No.
You, you don't have that issue.
No.
But yes, we do also address long toes. As I said before, not only long, but also short toes. Toe lengthening, toe shortening, foot slimming. We make feet smaller, yes. But I think that, let's go ahead and flip the camera again, Monique, if you don't mind.
Mm-hmm.
Let's give the world a visual here, right? And again, for all the people joining us now, the idea is to try to enhance the appearance, right? Enhance. You do have some small little bunions there, but I assume that doesn't really bother you, right,
What do
Monique?
you see some bunions there? Oh yeah.
The little bunion here, the toe moving inwards a little bit, doesn't bother you. Are you there, Monique?
I'm here.
Oh, okay. Do you make feet smaller? Yes, we do. Anything else? Anything else? You only want feet surgery? Any? Absolutely, yes. There's no question that structure does play a vital role, right? Weight is on the value. I've seen girls have surgery, lose the weight, and it's still in their ankles and knees. Absolutely, surgery 411. I definitely agree as well that some individuals, lose the weight and it's still will have the good old cankles, right? They're asking you to join in the convo. You can flip the camera, unless you want people to just take a look at your feet. We'll just leave it there. Any other questions? Questions?
They want to know how severe is the pain. Is it painful?
Just like any surgery, I mean, we do provide a long-acting local anesthetic, right, to minimize post-operative discomfort. That's something that we do. Every patient is different. Every individual is different, right, when it comes to surgery and post-operative pain. But it's not as bad as people think. It's not as bad as people think. Number one, this is only soft tissue, right? Again, as I said before, it's kind of like a tummy tuck for the foot. So it is only soft tissue. We provide not only, pain medications, anti-inflammatories, antibiotics. So we do cover everything to make sure that the patient is comfortable. Okay. Yes. For any before and after pictures, you guys can take a look at our IG page, Jaws Podiatry. You'll see a lot of beautiful transformations there. And maybe Monique, if you'd like, you can maybe drop our information there once we're done?
Yes, I'll make sure I pin
She
all
would
the
walk
information.
after, yes, she's going to walk after foot surgery. We're talking about foot surgery. What about the ankles? No complications there. Some people are talking about maybe some balance issues. No balance issues, ladies and gentlemen. Okay. She's going to actually possibly even walk better. How many stitches? The stitches are on the side here, right? It really depends on how much of the soft tissue we remove.
And if you just want to go over the recovery time once again, so
Yeah,
somebody just.
with respect to the recovery, again, just to kind of recap, all of the procedures performed here in our office-based surgical suite. By the way, we're located in Hollywood, Florida, Miami, Florida. Monique will be awake. Monique will walk in, walk out. We provide these ugly shoes. Those shoes are used for approximately 4 weeks or so. The stitches are removed at 2 weeks. And then I would say from start to finish, we're looking anywhere between 4 to 6 weeks. So can people drive? Yes. Can people go to, in respect to necessity, commodity, obviously going to the supermarket, things I try to tell people, limit the level of activity, right? We don't want to jeopardize or compromise anything post-operatively. Um, how do you handle your followers?
Yeah.
Yeah, there's some bruising. Let's see here. Let me go all the way down. I'm like way back. Okay, Monique, you
So
acting like
I need to prep for it before doing the surgery. Like, do I have to have any like pre-op blood work?
absolutely. We absolutely medical clearance is a must, right? Just like any surgery, even though minimally invasive surgery, 100% medical clearance. We follow all the guidelines to the highest standard of the care. Um, you have a black line, absolutely. Anything from surgery? Yes, we do treat any issues with toenails as well. Foot slimming, foot slimming surgery, ladies and gentlemen. He just cares about the money. Yeah, absolutely. Health and wellness first, guys. Any other questions for myself or for Monique, guys?
I got a question box. Okay, so somebody asked, are you just resizing the length or the width too
So,
with the feet?
in your particular case, I don't think there's. I think the focus should be what really bothers you the most, right? Possible foot slimming. Obviously, for people that are seeking not only the foot slimming but also making feet or the foot smaller, we can definitely do that at the same time. Believe it or not, all of these procedures are a thing. A lot of people are seeking these procedures. Um, People from all walks of life, from all over the world, from all genders, yep, also resizing, yep. And some people are just simply not happy. They just feel sometimes that they're, Dr. Wagner, my feet don't match my body, right? And that's something that, us humans were funny in a lot of ways. I think that if something does exist to make yourself feel a little bit better, then why not, right? Yeah, we can definitely make feet smaller. Are keloids a concern? That's a great question. That's something that we definitely bear in mind. That's part of the preoperative work, workup. Yes, it really depends on the clinical presentation, but yeah, some people will request go from a 10 to a 9 to an 8. We don't really go by shoe size, but yes, we're able to reduce. Would you shorten your toes? Monique, would you shorten your toes?
No.
You take Apple Pay. Uh, Any other questions, guys? For all the people, yes, for all the people out there that would like to see some of the other transformations, just, go to our page. You guys are going to see some really great stuff there. No question. Yikes. Yes. Also the arches. Yes. People that don't have any arches, yes, we're able to recreate those as well. Monique, they're all confused. You want to elaborate?
Yes. So basically, I'm having a consult as far as like feet slimming. He also specializes in bunions, well, removing bunions, corns, any other issues that you have going on with your feet. So basically, I'm just on here getting a consultation.
I want to be very clear. Monique is not saying that she is going to already sign on the dotted line. She's ready for surgery. This is a consultation, ladies and gentlemen.
Yes, just a consultation.
It's a consultation. We're educating here. Then your feet will be hurting, still carrying your weight. What's the page name? Jaws Podiatry. JAWS Podiatry.
I'm going to save the live to my page and put all the information on the video.
Doctor, how's my back feeling after carrying this live? I feel absolutely wonderful. I feel like a new man. Oh, my God. No, but on a serious note, guys, I want to take this opportunity. Obviously, Monique reached out, and I said, what better way to educate, right, and let people know that cosmetic foot surgery is a thing. Definitely, our goal is to educate, right, and using a platform such as yours, I think will only bring positivity. And there's a lot of people out there that they don't know, right? They don't know that this, they may not be happy with the appearance of their feet, whether it's the corns, the long toes, they're just not happy. And that's one of the things that we will continue to do, which is to educate, right? Yes, plantar fasciitis, absolutely. All of those clinical presentations. A lot of people love you, Monique. you're definitely, they love you. I mean, we love you too. Let's be very clear. Yes.
So
Tokyo.
The question they keep commenting about my BMI. Is there a BMI requirement?
Great question. We unlike other elective surgeries, we don't really look at I don't look at BMI per se, right? Of course, as I said before, all of our patients need to go through a medical clearance, which includes the blood work, the EKG, the test, chest X-ray. We do everything to the high standard of the care. If for whatever reason there's a patient that needs a cardiac clearance, that's what the patient needs, right? Number one, do no harm, right? But it's something that we, at the top of the list, top priority, health, safety, top priority. So we don't really look at, oh my God, BMI. That's that's one, it is a very important variable, but it's not the only variable that we look at, right? Yeah, they like the lips. They like the guys. Let's stick to the feet. It's the wrong end. Come on, guys. Okay. Anything else, guys? The shade room needs to. Yeah, for all the people asking, yes, Tokyo was recently here.
And this is feet slimming as local anesthesia, right?
Absolutely.
Okay.
A great question. Yeah, we do go by centimeters, right? Not inches. If it was inches, we'd probably, it wouldn't be such a great thing. The procedure takes about an hour and maybe 15 minutes or so. An hour. Can gel polish increase nail fungus? It's a loaded question. IG page, Jaws Podiatry, JAWS. She already, yes, Monique did show her feet to the world. For all you guys that missed it, I'm so sorry.
I'll show them again for all
Oh,
those.
there we go. Let's go to this is the Feet Finder money shot, right, Monique?
Mm-hmm.
Look at those beautiful feet. So, if you put both of your feet on the floor, Monique, I think people will get a better idea, right? On the side, right? This is the area, right? We have that. Our goal is to achieve that hourglass appearance. Does your feet hurt? Do your feet hurt, Monique?
No.
They look swollen. Maybe there's a little bit. Go ahead.
No, I'm saying they are.
Yeah. So what about the ankles? What about the ankles? Do your ankles bother you, Monique?
No.
For the ankles, for the good old cankles, that's what people don't like. Sometimes there's these unsightly like bulges on the sides of the ankles, the good old cankle, right?
Mm-hmm.
No, she doesn't have any pain around the ankle. What's going on, y'all?
So you want to do a quick recap for those who
Yeah, we're talking about Monique's beautiful feet. That's what we're doing. And essentially, Monique is possibly interested in undergoing foot slimming surgery. Here, that's what we're talking about. Feet. We're congregating here, all of us, talking about Monique's feet.
I cannot with these comments.
People love feet. Why do people love feet? Let's see. I can do this all day. Golly. Yep, that's it. You got it. Foot slimming, toe shortening, foot slimming, corns, ugly corns. That's something that we see a lot here. There's no question. No, Dr. Widener is going to focus on the toes. Yes, only the toes. We're talking toes, not cankles. One of the things that we were talking about before, Monique, was also like the good old toe tuck, right?
Mm-hmm.
A lot of people that come here, they're just not happy with, the girth of their toes. And believe it or not, we're actually able to kind of just do that tummy tuck for the toes as well. Crazy, but true.
Someone asked, can it revert back at any point?
No. Now, this is interesting. The short answer is no. I've never had a patient that after we perform the side tuck, the slimming, they'll come back and say, hey, I would like for you to put back the fat there, right? It's never happened. And that's something that I would not recommend either, right? That's it. It's called a feet BBL. Or BBL. Okay, let's see here. How does the scars look? So that's an excellent question. Again, the only way we're not performing liposuction, lipoaspiration, we're not doing anything of that nature. What we're doing is basically excising, right, on the side. It's a little tummy tuck for the foot. A lot of things inspired me. Absolutely. I like, first and foremost, helping people feel better about themselves. She will be able to walk. He needs to stop. Monique.
Yeah.
You want to ask some other questions?
I'm sorry?
Want to address some other questions?
I'm going through this question box.
Okay. You're just enjoying the wonderful questions.
So someone says, I had bunion surgery before, pins and bolts, and my bunion came back. Is this fixable?
Absolutely. And that's a great question that you just chose, just because a lot of people that come here also are looking for revisions, right? Whether it's a bunion, whether it's a floating toe, a lot, I would say at the top of the list, floating toes, or short, or toes that have shortened too much as a result of a previous surgery. So yes, we do a lot of revision surgery, which is something that that's really, really important. You know, revision surgery is very, very tricky. But using our minimally invasive techniques, we're able to and close that gap, right? For all the people that are asking for before and after pics, just go to our our page, Jaws Podiatry. Hey Monique, have you ever sold your feet pictures? Someone is asking.
No, I haven't, but I heard that I should have, so maybe I should start that on my OnlyFans.
That's big bucks.
Yes.
But wait after the surgery.
Mm-hmm.
Or not. Maybe people like, your feet just like that.
Yeah.
Maybe you can capitalize before and then after.
Mm-hmm.
You can double dip. Yes. A lot of people have a lot of issues with their feet. I agree.
So they want to know how long would you have to wear the boots? All 4 weeks?
They're not actually, they're not the big boots. They're just shoes that we provide. They're not Gucci's by any means, but they're very functional and they work. Get that money, Monique. Great question. If you're diabetic, that could be the issue. I mean, for diabetic patients, again, same thing. We do a medical clearance. A really, we follow all the criterias to make sure that safety is our top priority. Okay. Yeah, there you go.
And they want to know, do you take insurance?
For anything pertaining to insurance, anything related to that department, just please, call one of our concierge team members here, and they'd be more than happy to answer any and all questions.
Somebody said, can you make Derek taller?
Can I make what? What is it? Oh my God. This is like the improv here. Sheesh. Let's see here. Monique, why are you wasting his time? Oh, come on. Archie, but too high. Great question. Okay. Any other questions, guys? Bathing. Yes. We do provide the shower caps. She will be able to shower, not a problem. Okay. This life is insane. I agree. How much does a foot BBL cost? Any other questions, guys? For myself or for Monique?
Like you said, you can go onto his page and see before and after pictures and see what else he specializes in. I'll make sure I pin and tag all his information. So if you're interested.
Hey Monique, let me ask you a question. Will you consider doing an OnlyFans page after?
Yeah.
That's what
probably.
About. Booyah. OnlyFans.
Mm-hmm.
Pain level. Yes. There will be, again, we spoke a little bit about that, about discomfort. And what is this live about? Feet. 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 Monique is possibly considering foot slimming surgery. Yes. Foot slimming is a thing. These are some bizarre questions. Sheesh.
Yeah.
Wow. Hey, someone's asking, how much would you sell your feet pictures for, Monique?
I have no idea. I haven't really looked into all of that.
You got to say they're priceless. You can't put a price
but
on
I'm
them.
really going to come up with a price list, though.
100%. Look, people want to see your feet again. Now they're going to have to pay for it. That's right. Monique, you want to go ahead and close it up?
Sure. So I'm gonna pin all the information if you're interested in feet slimming, any bunion, corn removals. It's gonna be pinned after this live. Is there anything else you would like to say,
No,
Doctor?
no. I just want to take this opportunity. Obviously, Monique, thank you for reaching out. We really appreciate it. We're always here to help. For all the people out there, thank you for partaking in this absolutely wonderful live session that we've had today with Monique. If you guys have any questions, again, Monique will have all the information there. If you guys have any questions about anything related to feet, surgery, cosmetic foot surgery, anything to enhance the appearance of your feet, we're here to help. Okay? You guys are very welcome. Am I single? No. Happily married. Maybe they were asking you, not me.
Thank you so much for doing my consult.
Absolutely, absolutely. Anything else, guys? I'm gonna let you sign off.
All right, so all the information is going to be listed below in the live. If you have any questions or concerns, you'll be able to reach out to him directly. Bye, guys.